Gastroenterology, mesh heading, is the branch of medicine focused on the digestive system and its disorders. Diseases affecting the gastrointestinal tract, which include the organs from mouth to anus, along the alimentary canal, are the focus of this speciality. Physicians practicing in this field are called gastroenterologists. They have usually completed about 8 years of pre-medical and medical education, a year-long internship, if this is not a part of the residency, 3 years of an internal medicine residency, and 2 to 3 years in the gastroenterology fellowship. Some gastroenterology trainees will complete a 4th year, although this is often their 7th year of graduate medical education, in transplant hepatology, advanced endoscopy, inflammatory bowel disease, motility or other topics. Hepatology, or hepatobiliary medicine, encompasses the study of the liver, pancreas, and biliary tree, while proctology encompasses the fields of anus and rectum diseases. There are traditionally considered subspecialties of gastroenterology. History. Citing from Egyptian papyri, John F. Nunn identified significant knowledge of gastrointestinal diseases among practicing physicians during the periods of the pharaohs. Irinacti, of the 10th dynasty, c. 2125 B.C., was a court physician specializing in gastroenterology, sleeping, and proctology. Among ancient Greeks, Hippocrates attributed digestion to concoction. Galen's concept of the stomach having 4 faculties was widely accepted up to modernity in the 17th century. 18th century. Italian Lazzaro Spallanzani, 1729–99, was among early physicians to disregard Galen's theories, and in 1780 he gave experimental proof on the action of gastric juice on foodstuffs. In 1767, German Johann von Zimmermann wrote an important work on dysentery. In 1777, Maximilian Stoll of Vienna described cancer of the gallbladder. 19th century. In 1805, Philip Bozzini made the first attempt to observe inside the living human body using a tube he named Lichtleiter, light guiding instrument, to examine the urinary tract, the rectum, and the pharynx. This is the earliest description of endoscopy. Charles Emile Troisier described enlargement of lymph nodes in abdominal cancer. In 1823, William Prout discovered that stomach juices contain hydrochloric acid. In 1833, William Beaumont published experiments and observations on the gastric juice and the physiology of digestion. Following years of experimenting on test subject Alexis Street Martin. In 1868, Adolf Kussmaul, a well-known German physician, developed the gastroscope. He perfected the technique on a sword swallower. In 1871, at the Society of Physicians in Vienna, Karl Sturck demonstrated an esophagoscope made of 2 telescopic metal tubes, initially devised by Waldenberg in 1870. In 1876, Carl Wilhelm von Kupfer described the properties of some liver cells now called Kupfer cell. In 1883, Hugo Kronecker and Samuel James Meltzer studied esophageal manometry in humans. 20th century. In 1915, Jesse McClendon tested acidity of human stomach in situ. In 1921–22, Walter Alvarez did the first electrogastrography research. Rudolf Schindler described many important diseases involving the human digestive system during World War I in his illustrated textbook and is portrayed by some as the father of gastroscopy. He and Georg Wolf developed a semi-flexible gastroscope in 1932. In 1932, Burrell Bernard Crohn described Crohn's disease. In 1957, Basil Hershowitz introduced the first prototype of a fiber optic gastroscope. 21st century. In 2005, Barry Marshall and Robin Warren of Australia were awarded the Nobel Prize in Physiology or Medicine for their discovery of Helicobacter pylori, 1982-1983, and its role in peptic ulcer disease. James Levitt assisted in the research, but the Nobel Prize is not awarded posthumously, so he was not included in the award. The word gastroenterology is a combination of three ancient Greek words: gamma, alpha, sigma, tau, eta, rho, gaster, gen, gastros, stomach, nu, tau, epsilon, rho, omicron, nu, enteron, intestine, and lambda, omicron, gamma, omicron, sigma, logos, reason. Disease classification. 1. International Classification of Disease. ICD 2007. WHO classification. Chapter 11. Diseases of the digestive system. KOOK 93. 2. Mesh subject heading. Gastroenterology. GO 2.403.776.409.405. 3. Gastroenterological diseases. CO 6.405. 4. 3. National Library of Medicine Catalog. NLM classification 2006. Digestive system. W1. 5. Gastroenterological societies. World Gastroenterology Organization. British Society of Gastroenterology. United European Gastroenterology. United States. In the United States, gastroenterology is an internal medicine subspecialty certified by the American Board of Internal Medicine, ABIM, and the American Osteopathic Board of Internal Medicine, AOBIM, American College of Gastroenterology, American Gastroenterological Association, American Society for Gastrointestinal Endoscopy, Massachusetts Institute of Technology, OMS, Society of Gastroenterology for Sopranos. Research resources: Annals of Gastroenterology and Hepatology, Scandinavian Journal of Gastroenterology, UEG Journal. Publications: journals at DMOZ.